Daktari, a quick one here. So today in medicine, I want to address a very pertinent issue, and that is mortality and morbidity. For those who don't understand, this simply means sickness and death, like what makes people sick and what makes people die the most. So I've been doing a little looking. This is research by looking, and I've come to a very strange realization that the most common cause of people in our population in Kenya getting seriously ill and being admitted, and some of them going to as far as losing their lives. It is not the common things we think about. Stay with me here. It is not cancer. Imagine. It is not HIV. It is not diabetes or any lifestyle disease. It is none of those diseases we think about. The biggest, and by far, the biggest cause of mortality, of death, of disease is poverty. Poverty. Because I've realized that people who have a good health-seeking behavior, they don't have it because they like going to hospital. Nobody in Kenya likes going to hospital. They have it because they have the means, the capabilities. They go to hospital because they are able to pay, or they have an insurance that is paying for them. So you'll find people coming with even the slightest of complaints. I'm to a skipper, they're in the hospital, they want to know what's up, And then I was talking to another patient the other day, and they made me realize something that's actually very, very interesting. Insurance companies, and I think kudos, they encourage their patients, their clients now, to do annual checkups, and they remind you, go do an annual checkup. And we had a chat with this patient, and it turns out they do this so that you don't get a serious condition that will lead you to be admitted, and now it will cost them more to pay for your health. So they'd rather you go for annual checks, and the doctor sees you, and we run the test, and we say, okay, sawa, you're okay for the next 1 year, you'll be fine. And the insurance company doesn't have to lose a lot. I mean, that's genius. That's genius. But then, people who do not have this privilege, people who cannot afford these checkups, the poor, people who cannot afford to do the checkups, people who, even when diagnosed, when you work in the villages and you really have to, you face this, when you work uko kwa kijiji, mashinani, kwenye politicians wanakujanga kutafuta kura, na ile lesson na 50 bob. When you work there is when you realize, oh my God, Jesus Christ, watu ni wagonjwa. Because that is where people will come with uncontrolled sugars, and it's not that they didn't know. They knew they had diabetes, but they didn't have money to get medication. They'll come with legs that are rotting. They have to be amputated. It's not that they didn't know, that they didn't see when they had the small kakidonda on the big toe, but they just didn't have the money to go to the hospital. Or when they go to the hospital, sometimes because the governor is, who you elected, that one, because it's the governor. Hospitali haina dawa, hospitali hakuna daktari, hospitali hakuna x-ray, hospitali hakuna blood test for this and that, or they are being told you have to pay to be admitted, to be seen, and they don't have the money. They go home, the leg rots, and it rots, and then they end up coming gone. Mambo imekuwa mbaya, have to be amputated. There's a patient I saw, it was just bone, mguu yote imeenda, ni mfupa tu imebaki. So poverty is the leading cause of death, and is the leading cause of severe illness in Kenya. I don't know what we're gonna do, but gava imeshindwa. Well wishers, people wenye mko blessed kidogo, like Rotary, people, watu wa Rotary, do something. Like those health camps, if you're privileged, if you have a hospital that you can conduct a health camp, go, please give them medication, give them free consultation. As will be going a long way. Otherwise, we will try our best at Daktari, a quick one. That's today in medicine. Adios.